Tonight, August 6, Mississippi finds itself #1 in the country with positive COVID cases per capita. Our hospitals are overwhelmed with coronavirus cases and very burdened healthcare workers. In-person school has started for some, and for others, it's just around the corner. But are we starting school too soon?
I really do want the children and the teenagers to get back to school. I do. I think that is the best educational environment. They need that, the social interaction. Children that have special needs especially. There are a lot of reasons for the kids to get back to school.
As head of the state's only academic medical center and a level 1 trauma center, Woodward has been dealing with a pandemic, putting UMMC at the epicenter of critical care for critical patients with the coronavirus.
As soon as an ICU bed opens up, there are patients there to fill it back up right away.
Smaller hospitals across the state are fighting the same virus with very sick patients needing extreme care. UMMC has always been there for these patients, but that's not a guarantee anymore.
But the level of complexity that we're seeing with these patients is such that many times it exceeds the capacity of the smaller hospital, and they need to transfer them here. We have been of late in the terrible position of receiving transfer calls and not being able to help and not being able to take the patients.
Woodward says Mississippi is still on an upward trajectory with COVID-19, and she doesn't know when we'll see a decline. She sees the governor's mandatory mask mandate as a good move forward if folks will comply. But as far as kids going back into the classroom, she's worried about how safe it is with the trend still going up.
I think with some time we'll get a handle on this, but we're not there yet.
And Dr. Woodward also acknowledged that for people who live with a lot of other family members, that social distancing, which is effective, becomes very challenging in that setting.